We are looking at an anterior view of the right humerus. Proximally, we have the head of the humerus. This is the part that articulates with the glenoid cavity of the scapula to form the glenohumeral joint or shoulder joint. Then we have these two protuberances. The larger, more lateral one is the greater tubercle. The smaller one, somewhat more anterior and medial, is the lesser tubercle. Between the two tubercles is this groove called the intertubercular groove or bicipital groove. This is where the tendon of the long head of the biceps passes through. Between the head of the humerus and the tubercles, we have the anatomical neck of the humerus. Just distal to the tubercles, we have the surgical neck. This represents the shaft of the humerus. About halfway down on the lateral aspect of the humerus, there's a roughened area called the deltoid tuberosity. This is where the deltoid muscle attaches. As we continue distally, we'll come to this area here. This is the medial epicondyle, and then we have the lateral epicondyle. If we just move a little proximal to that, those epicondyles, specifically here, the lateral epicondyle, we have the lateral supracondylar ridge. And then from the medial epicondyle, we have the medial supracondylar ridge. This area here is the condyle, and there's two parts to the condyle. This more lateral aspect is the capitulum. The more medial aspect is the trochlea. Then we have these two small or shallow fossa. We have the radial fossa, where the head of the radius comes in. And then we have the coronoid fossa, where the coronoid process of the ulnar comes in. If we just turn this over and look at a posterior view, this is somewhat a little bit deeper fossa. This is the olecranon fossa, for the olecranon process of the ulnar.